So often we worry about our teeth. Are they wide enough? Are they straight enough? And sometimes we forget about our gums, and it's our gums that are truly the key to beautiful teeth. Joining me today from StoneRidge Dental Care is Cynthia Levy. Cynthia, thank you so much for being here.
Thank you for having me.
And isn't that true? I mean, we look at the outer part, but it's that inner part that holds the teeth that really is the key to everything.
Of course, it is.
How do people know, and what is, first of all, gum disease or periodontal disease, and then how does someone know if they have it?
Gum disease is basically a low-grade bacterial infection that's in your mouth. So it is an infection. It is definitely an infection. And there are certain bacteria that are associated with it. Some people are more prevalent, more prone to having gum disease just because of the chemical nature of their mouth and of their saliva, etc. So it's not always something that some people can go through life without any problems. Other people suffer from it all their life.
Is it a genetic thing? I mean, if your parents had some issues, would you?
Possibly. We do know that it's probably communicable. So if you have a spouse with gum disease, you can pass it on. Through kissing.
Wow.
Yeah, exactly.
I didn't know that.
Exactly, yeah.
So there are germs that are trading back and forth because it is an
right.
infection. Okay, so how do you know if you have it? What are some clues?
Any signs of bleeding when you brush your teeth or floss are probably the hallmark signs. And if you do have blood, it's not natural to have blood, you know, in your mouth when you brush your teeth or when you floss. I like to use the analogy, and we do so in our office, that if every single time you washed your hands, your fingertips bled, would you be concerned? People say, of course I would be concerned. I'd be right off to the doctor. But they don't think anything of it when it's their mouth. So any sort of bleeding when you brush or floss is a sign that there is something going on. There is an infection.
Now, you can't treat this.
You can treat it.
I mean, and I would think the earlier the better.
Obviously, the earlier the better. If it's a very mild form, what we call gingivitis, good oral hygiene. Getting your teeth cleaned, making sure that a hygienist makes sure that they're sparkling clean, and then regular brushing and regular flossing and perhaps more frequent visits to the dentist can get it pretty much under control pretty quickly. Can
flossing irritate your gums so much that you create periodontal disease?
No, I don't think so.
I mean, flossing is an important thing to do, even if you're not used to it, and it might hurt a little bit. If they keep doing it, then the gums get used to that.
Exactly. The gums are usually inflamed when they're infected. So when you are using the floss, you actually are somewhat disturbing that gum tissue. It's sore. It's inflamed. It's like if you had an infection on your hand and you were pushing on it. It's that same sort of effect.
So gingivitis is easier to treat because it's the beginning. What happens if they're later stages, if people just, as you say, put it off?
It just gets worse, and the gums become more inflamed. There's more recession. And what starts to happen is that the gum tissue starts to pull away from the tooth. It creates those pockets. So if you've been to the dentist and they've said you've got some deep pockets and we need to do a deep cleaning, that's what they're talking about. Eventually it leads to bone loss.
In the teeth?
Actually in the mandible, in the maxilla, in your jaw bones, you actually will lose bone. And then what starts happening is the teeth lose their anchors and they become loose. So in terms of what it is in your mouth, it eventually leads to tooth loss.
What can you do then at that point? The deep cleaning and... I suppose the earlier the better, the easier the treatment.
Correct. We used to call it deep cleaning. Now we do a procedure that uses low-frequency ultrasonics and the placement of medication in the gums. It's sort of an antibacterial. And it helps tremendously in terms of getting the teeth, the gum back into a healthy state.
And one last question, because I know I deal with this. I'm a heart survivor, and there have been ties between gum disease and flossing and things and going to the dentist, and I have to take an antibiotic before I have a cleaning each time. What is that relationship between heart and gums?
The relationship is infection. And when you have infection, you have inflammation in the body. And that inflammatory response that the body kicks out is related to heart disease, to stroke, uncontrolled diabetes. Some cancers, including pancreatic cancer, they're now showing a link between periodontal disease.
Wow.
So if you have a history of heart disease, a history of, if you have diabetes and you have difficulty controlling it, sometimes the first place you should look is in the mouth. So we do try to educate. We work a lot with the medical community to educate them, to ask their patients, you know, when was the last time you were at the dentist? Look inside the mouth. If you see inflamed, red, puffy gums, you know, chances are that infection is hampering anything
Very interesting. The ties there to our whole body. Isn't that funny?
It is whole body health now. It's not just about your teeth.
Cynthia, thank you so much. Good
Thank
education.
you. Thank you.
And we'll be right back with more Daytime.